Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. And today we are extremely excited and blessed to have the one and only Elmer González, my hygiene school bestie, aka the director of Doña Ana Community College now, and so many other titles, really. And I'm going to have Elmer just talk about your career path. We graduated from the University of New Mexico in 2008. I went into practice, and you continued to pursue your dreams of continuing education and special needs as well. So you have the floor, Elmer.
Thank you. Thank you guys for having me. It is a pleasure to be here. And yes, I mean, my best friend, Amanda, and, really excited to see you leading this podcast and Joffrey as well. So thank you for having me. And um, yeah, so we finished dental hygiene in 2008. It sounds easy, but not an easy task to accomplish, as all hygienists know. Um, my career has been interesting, to say the least. Not interesting in a bad way, but interesting in a good way. I feel that I have had the opportunity to expand my career in different horizons. After graduating from dental hygiene school in 2008, when you, Amanda, went to private practice, I decided to stay more so in the teaching environment. Because after graduation, I did get, the opportunity to work at the University of New Mexico, primarily as a clinician working in the special needs clinic, basically serving individuals with disabilities. But then that work also opened up the door for me to work very closely with some really great mentors, Christine Nathy and Dimitra Logoteris, which then allowed me to get my feet wet and get more into the education part of the house. I remember that I started teaching the special needs course because I was the clinical dental hygienist of the special needs clinic. But then that was a good fit for me to start teaching special needs in dental hygiene. Now, with that, obviously, if I wanted to remain working at the University of New Mexico and pursue my career in teaching and being a clinician at the same time, I had to pursue my master's degree in dental hygiene. And when I say I had to, it doesn't necessarily mean that, well, I had to do it. I didn't want to do it. No, I did want to do it. It was something that I felt very, very passionate about because I really enjoy dental hygiene. So I did go and finish my master's degree in dental hygiene in 2010. Had the opportunity to join some different educational opportunities as part of the master's degree, and I mean, you know me, I'm always exploring different things and trying different things. So, completing my master's in dental hygiene was great, but I didn't feel that I had fulfilled my desire of learning, right? So, I said, well, why not? I started looking around and I joined the master's in educational psychology, which at the time I was like, well, do I really want to do education? But once I actually started the educational psychology program at UNM, it was very enlightening, very eye-opening. Learned a lot of different things about teaching, educating, assessing students. Basically all of the psychology behind education was given to me in this particular masters, and just from there, that just insight and my desire to keep going. And later on, I joined the Ph.D. in educational psychology, and not being busy enough, I guess. At the same time that I was doing my PhD in educational psychology, I also joined the M.B.A. program. So I was doing both the MBA and the PhD at the same time while teaching and doing clinical work. So,
Elmer.
you know,
I don't know how else to
Wow.
say overachiever, Elmer.
Yes, overachiever award
Is it
goes to
because
Elmer.
you missed doing my load work in school as well as your load work in school that you needed to compensate for that?
Well, I mean, you put it in a way that you never did any work, and that's not true. I mean, you did a lot of work. Yeah, I might have just helped a little bit, but um, no, I think I think since I was little like in my teenage years, at some point I had this dream of going to dental school, and then somehow I wanted to be get an MBA and be a manager or a boss of a big company, and all of those dreams didn't work out, right? I ended up doing what I actually enjoy doing, which is dental hygiene and being an educator. So I think those other aspects were more of a teenager thinking, well, what is it that I really want to do? But then as I grew up, I did have the opportunity to pursue and get those degrees. Not the dental degree, but the MBA and then the doctoral degree. Um, and that actually has had some really positive impacts in my not only my personal life but also my professional career. All of this combination of degrees and experiences um, have also or actually merged really nicely in my job as the program director, department chair, because when I'm trying to manage the program where I use my MBA skills, when I am trying to develop curriculum, I use my educational psychology skills, talking to students, faculty, staff, sometimes addressing issues. I have to get the manager out of me, but in other instances, I have to be more of a leader. And those are sometimes hard things because separating a manager from leading or being a good leader might be challenging for some people, but once you get a little bit of practice doing that, it gets a little easier. So I always say the manager is the mean one, the leader is the one that you just want to be able to be a good role model and support your faculty, staff, and students to achieve the goals that they want to achieve in the best way possible. But
that sounds like the role of a dad, doesn't it though?
I like that. Just saying that the manager role and the leadership role are two different hats. Like the manager is kind of the mean one sometimes. I like the way you said that, but the leadership is like the like you're gonna follow this person and you trust them. Like it's a guidance. We're guiding you to the correct destination here, but with the manager, you do have to play the bad guy sometimes, but the leader doesn't always have to play that role.
right,
So
right.
I like the way you said that, Elmer.
Yeah. So in short, I mean that's been my career journey. It's been many years. I mean I really spent, believe it or not, and for those of you listening to the podcast, sometimes if you have students listening or individuals wanting to pursue something, well, sometimes we think, well, it's 4 more years. Oh my gosh, like I can't take 4 more years out of my life to do what I want to do. And the way I see it, even before getting into dental hygiene, I completed a prior bachelor's degree. So I literally was I in college from 2001 until 2018, which is when I graduated with my doctoral degree. So that was 18 years of my precious life in school, right, learning. But I don't regret even 1 minute. What I regret, though, are the student loans.
Mm,
When I see the when I see
sure.
the bill, I do regret it, but I don't regret what I learned by any means.
Well, and going back to that perspective of 18 years, yeah, when you look at that 18 years, especially when you're in your 20s, oh my gosh, that's daunting. You're missing out on the best years of your life. Well, that 18 years or however long is going to go by whether you do that or not. So,
Hmm.
unless that's not a passion, like a true passion, yeah, maybe don't waste your time. Don't take out those student loans. But yeah, why would you not want to be done with that achievement and accomplishment by the end of that time period? because where else are you going to be, you know?
Right. When it's I think what's very important too, and feel free to stop me. We're going on a tangent, but I think what's very important too is for us to have goals, right? Like
Mm-hmm.
I think what helped me to you know keep myself focused and complete these degrees that I wanted to complete was that I always set myself goals. I remember back in 2010 when I was doing my master's in dental hygiene, and I joined a program, an educational leadership in neurodevelopmental disabilities. And one of the exercises in that program was to set your 5-year goal, your 10-year goal, and then smaller objectives on how you would accomplish that goal, right? So very clearly remember I set my goal, okay, by the age of 35, I'm going to have my PhD. And I didn't know in what. It was just, okay, I'm going to have a PhD. And, as I was approaching my 35-year birthday, I was like, oh my gosh, I don't have my PhD. I don't have my PhD. I need to accomplish that goal. But yeah, so I did accomplish it, by the way, at 36.
Well, congratulations, Elmer. Having a PhD is an incredible accomplishment. When you said that you are like, my only regret is the student loan, that really resonated with me because I had gone to a school that was like a private hygiene program. It was very expensive. And I knew right away that it was going to be me and my student loan going everywhere. I feel like I wear it like a backpack. All right, it's
Mm-hmm.
Joffrey and her loan walking around. And I mean, 10 years later, I'm still just making payments on it. I have only made a dent. I do not think I'm like the poster child of how to handle your finances. I'm the poster child for other things, but not that one. That is not my forte. Um, in in my experience, like having that student loan, I treat it almost like my water bill. I'm like, oh, it just comes every month and we just pay it, and it's
Right.
no big deal. Like it's very nonchalant at my house, but there's also like no urgency to pay it off. There's no it's just kind of just there forever.
Mm-hmm.
And what you said just resonated with me because I thought, oh my gosh, that's me. Like I do regret the loan. I do
Yeah.
wish that I didn't have this almost semi water bill coming every month, right? Like
Yeah. Well, but on the flip side, though, I mean, there are pros and cons, right? I mean, the con is that yeah, we regret it, but the pro is that I mean, thanks to the student loans, we were able to complete our degrees, our
Mhm.
degree in dental hygiene, or after other degrees, and whether or not it was a choice or we had to do it because we had to do it at the time. In a way, we have or we are where we are thanks to being able to get those student loans, right? Um, I mean, not everybody has the benefit of going to school and not accrue debt. So I mean, kudos to those who do not have to accrue that, but those of us who have to get in debt to go to school, at least we don't have to pay the whole amount back. Yeah, it's cumbersome to pay the bill every month, like you say, but we have to think about the positive, right? Well, thanks
I
to
like
that, we went
that,
to
Elmer.
school.
You're absolutely right. I'm wondering, did you feel pressure like being a spouse to complete your degrees?
Yes, I did feel pressure to complete my degrees, and I also felt pressure to get student loans because even I mean, it's reality, right?
Mhm.
Being a parent and going to school is not easy. Sometimes you have to get in debt. You have to get student loans to get by. Because your job may not give you all of the resources or everything that you need to cover your expenses while you're in school, while covering your expenses at home. And I mean, if the help was there to be able to do that, that's that's what you have to do, right?
Yeah, absolutely. I mean, I
Mhm.
asked because I'm thinking about my own experience, and I originally really, really, really wanted to be a dental hygienist. And then my daughter was born, and I was just so infatuated and so in love with her and just loved staring at her.
Mhm.
And I thought there's no way I could go to hygiene school. Like, my calling is to just look at this beautiful baby all day. Like, there's nothing else in this world I'm supposed to do. And my spouse was like, "No way. You have to go get your education." Like, he was very much so, "Go finish
Mhm.
school." So I felt so I did have some pressure to go to a hygiene school as a spouse and get that degree. And now that that little baby is turning 11 soon, she doesn't need me to stare at her all day. And I'm very, very gracious to have my degree and something to do with my life other than just watch her the whole time. But it was definitely some like brain fog of being like this parent to a newborn happening that I had to get like pulled out of. Like,
Mhm.
there's
That's a
more
lot.
yeah. I was just tunnel vision. Like, this is my only thing in life right now. And my husband was like, "No way. You have got to go back to school and finish." And so today I'm incredibly grateful for him pushing me along the process because I love this profession so much. But now I see the bigger picture that, like, and some people can stay home and just be that home mom, and that's beautiful for those who can. But it definitely fits my lifestyle, um, being in the clinic,
Mhm.
and so I'm with you. I felt a lot of pressure to finish the degree and get
Right.
through school. Let's see here. Elmer, I want to ask you. So, moving from clinical practice to administration is a significant shift. What inspired you to take on the leadership role in a dental hygiene program? And how has that transition impacted your perspective on the profession?
Yeah. Well, that's a loaded question, right?
Yes, it is.
Um, but it's a great question. So I appreciate that. You may have to repeat pieces of it. But so transitioning. I think my experience has been a little bit different though, because my career has been almost a combination of both at the same time. So right after I graduated, and being completely honest, my private practice experience is limited to about 2 months. So, when I graduated from hygiene school, while I was waiting for my clearance paperwork to go through the university and all of that good stuff, well, I obviously needed to work, right? And I started temping in private dental offices while I was waiting for my paperwork. I worked in a couple of offices that were amazing, really great offices, um, very different. One was a state of the art office, everything brand new, everything digital, computerized. Then I worked in another office where everything was from like the 60s. They were still dipping the radiographs. And I remember very clearly, when I went to temp in that office, they tell me, okay, yeah, the patient is due for radiographs. So sure, I took the radiographs. It was film radiographs. I took the radiographs, and I'm walking all there, like everywhere around the office, looking for the processor. And so I come back to the front office, and I ask them, and where is the processor? I can't find the processor anywhere. And the lady at the front office looks at me and smiles. She says, we don't have a processor. We have dipping tanks. And I was like, I don't know how to do that. Like I learned it in school. Like I remember like learning, that you
Hypothetically.
put it in the fixer and then you rinse it and you put it in the developer and you rinse it. I said, but I have no idea how to do it. I'm sorry. Uh, the dentist goes and says, like, don't worry, I can help you with it. They were really, really nice, but I did get to experience the dipping tanks in that
Gosh.
particular office. And that was in 2008, right? Incredible. And Cavitron, I mean, the patients in that office, um, some of them have never had their teeth Cavitron. So when I say, I'm going to use the Cavitron, what is that? What are you talking about? So, going back into explaining all of that stuff, right? That goes into the teaching and educating the patients, and then getting them into, agreeing to let you do something that they have never experienced. That was the great challenge. I put it that way. But anyway, so that was the extent of my clinical private practice experience. Most of my clinical experience, as I mentioned before, was working with the patients with special needs in one of the hospitals in Albuquerque, which was part of the University of New Mexico. And I did both. So I did clinical and teaching at the same time. So in that respect, my transition from clinical to education was very seamless. But to answer your question about my transition to administration, that's a different story, right? So I worked at the University of New Mexico from 2008 to 2016. And in 2016 is when I got my position as a program director at New Mexico State University. So I feel that that particular transition from clinician slash educator to administrator um, was not as challenging for me because I did have the experience of being an educator for several years prior to administration and being a clinician for several years prior to becoming an administrator. The challenging part for me when I became an administrator was that I literally got hired February 1st of 2016. That's when I started here. That was my first day on the job. And 2 weeks later, the program was scheduled for an accreditation site visit. And if you're not in education, well, you hear a site visit and that's like, well, whatever, right? But if you're in education, a site visit is a big deal. And for me, that was like, oh my gosh, like what did I get into, right? I'm here 2 weeks, and in 2 weeks, I'm having my site visit, which I didn't put together any of the self studies. I didn't put together any of the documents. I have no idea what they're going to ask me. I don't know what I need to expect. Um, so that in and of itself was a nightmare for me. Those first couple of weeks on the job, and came to realize, once the site visit happened, uh, the site visitors were extremely nice. And I still remember both of them. And I've actually seen them in other meetings now, and I always go and talk to them. And their um, mentorship while they were here doing their site visit, and their encouragement to say, hey, even if things are not perfect, you just got here, we understand. You're going to have time to make changes and fix things and make it work. But their mentorship at the time actually gave me the courage and enthusiasm, I guess, to later on apply and get involved with the commission and become a site visitor myself. And now that I do site visits, I based on what I learned from them, I don't go to do site visits and I don't think I'm a mean site visitor per se, right? Like I try to be understanding of the situations and whatnot. But that was my experience on the transition. Now I am very comfortable. I think besides that particular challenge, what helped me in the transition was the fact that I had, received an M.B.A, that I had the teaching experience, that I had experience in curriculum design and management. So, that was a positive. That was all positive. Um, the other challenge, of course, is um, leading people, right? Because in education or in higher education, if you want to be successful, you want to be more of a leader rather than a manager. And that applies with faculty members, staff, and students, right? You want to be more of that role model, that person that they look up to, that person that they follow, just in the same way that I did with my mentors at UNM. When I remember when I was a student, well, when I was a student, I was terrified of the program director, first of all, right? Like,
Yes.
yeah, Amanda and I,
Reason.
yeah, like we would hear, I mean, we didn't, like, we would just hear the high heels, and we knew that was the Mitra Logotheris coming down. And the Mitra is like the sweetest person. Like, she's so nice, and she's a great mentor and role model. But as a student, I think we were just afraid because of the position that she held. But the Mitra and Christine were great mentors, great role models, and I did aspire to be like them one day and lead people the way that they led the individuals at the university. And I mean, I don't think I'm there by any means, but I'm trying my very best. So, I mean, hopefully that answers your question a little bit.
No, there's a lot to unpack going back to the dipping of film. That's such a quintessential New Mexico thing.
Mhm,
And it's probably so hard for students to understand, like 2008 was kind of like the start of the transition for so many offices
mhm.
from analog to digital. Like
Right.
there were years that we still had paper charts. My first office, we still had film, mainly as a backup, but we were kind of starting that transition. But digital panos were still very far behind. So, yeah, I mean, who's taught that anymore?
Well, we were taught that in 2015 still, how to develop the film. And
So silly.
however, seeking a job, if somebody still had an X-ray that needed to be developed, I was running far away from that job opportunity. I'm like, no, thank you.
Yeah.
That's crazy. Um, I will say, going to your very safe assumption that we were all kind of afraid of Demetra. Yes. I would say like fear as in like you're afraid of fire but you love fire, like
Mhm.
it serves a purpose. The only time I was genuinely afraid of her was when half our class failed anesthesia and she like came apart. Oh my gosh. She was not happy about that at all.
You know, when you're the student and you have that professor who is deemed like the strict one, the mean one, right? And you like dread them in a sense in that moment.
Mm-hmm.
And I had one of those. And then one thing that professor was very particular on in clinic was cleaning the chair base of your operatory, like the operatory chair, cleaning the base of it. But you could not end clinic until that chair was cleaned like floor level. And it, like, in the moment, it drove me mad. But now, 10 years later, as a practicing hygienist, the bottom of my chair is always clean. And I feel good about that. And I admire that instructor for being so strict about those types of things because I now see the grander picture that
Mm-hmm.
things do fall through the cracks. People are
Literally.
cutting corners wherever they can just to stay on time or whatever the reason may be, right? But um those hard instructors, like I have a newfound respect for them 10 years later that I did not have at that moment. But today I am like, without them, I would not be the clinician that I am today.
Mhm.
And so when I'm like speaking to students, I'm always telling them, your program is stacked with top talent. respect the people who are educating you and who are teaching you the way that you're going to follow forever from here on out. But that I'm sure those professors know that people they are intimidating and people are terrified of them. And I just wonder, like, do they know the impact they have in the actual profession, because they are shaping the future. Like, and I'm so grateful for them. At the moment I was not. I was terrified at the moment, and I was just like, this is so extreme. I don't know if I belong here. But now I am like this well-rounded clinician who pays attention to all the details. And it's not just cleaning the base of my chair, it's making sure I'm doing everything in that appointment sequence. So Elmer, as an educator, do you know when you're terrifying? Do you know when
Do you
Yeah,
wear silent shoes so people don't hear you coming?
I don't wear high heels. Let me just
But
say that.
men's
Um,
dress shoes still click. Oh.
but I mean, I think in our case, right? Let me just backtrack a little bit. I think in our case, um, it was not like so much fear. I would say it was rather respect, right? Because I mean, this instructor Geoffrey that we're talking about, Professor Demitra, she was the program director, and very intelligent individual, very well rounded in knowledge. I mean, she's the author of the anesthesia textbook, and for us was very intimidating, right? Very intimidating when she would call us to her office, or when we would see her in the hallways, or and 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 it's not that she was mean per se, because she's not mean. She's never been mean. It was just maybe her position, right? And to answer your question, what I have experienced now as the department chair, because I oversee dental hygiene and dental assisting, what I have experienced is something similar, which is very interesting, because I feel that I am a nice guy, that I am very open, that I am, I tell students, my door is open if you need anything, if you want to talk to me, if you need any support. But I think it's my position that makes them afraid, or they have this different level of respect, or whatever that might be, that they, when I walk into clinic, everything disappears, right? Like, they all go to their ops, and everything is well organized, and like you can see them, right? Like, when you walk into clinic, they're like, oh, boom, everything is back in place, um, which is very interesting. But I think that's what I personally did have experience similar to you, Geoffrey, with a clinical instructor, where you know. And Amanda, maybe Amanda remembers, we had this clinical instructor. Well, we had multiple, but they were all picking different ways. We knew, okay, if we have this clinical instructor, we better make sure that we scale the heck out of those routes, because she's gonna get that explorer, and she's gonna find calculus where there is no calculus, right? So we knew who that was. Then we had the other one that was into ergonomics. So if you were not sitting properly, if you were hunched over, she would go and tell you. Then you had the one that you could do whatever you wanted, right? Like, she would just give you A's and everything. So, I think as students in the clinical setting, we really know, like, we really get a feel for the instructors, and we test them, and we say, okay, okay, tomorrow I'm going to have so and so. I'm going to be doing clinical skill evaluations or testing with that instructor. I'm not going to wait for the other one. And I don't know, I think sometimes now as an administrator now, as the director, sometimes I think, well, that might not be the best thing to do, right? Because sometimes you learn more from the one that's very strict, as you mentioned, the one that challenges you to be your best. Even though at the time it might seem that, oh my gosh, like, I hope I don't have to see this person tomorrow, right? In clinic again. But, 10 years, 5 years after you're in clinic, you're a professional and you remember, okay, yeah, actually what this person taught me was very good. Um, Whereas sometimes, from the easy ones, from the ones that just give you A's for whatever reason, um, sometimes you don't really learn a whole lot.
Definitely. I don't know who this instructor was that gave you A's, Elmer. I think you just kind of had a special in with them, if you know what I mean. Anyway, I think we all had really good instructors, but
We did, yeah.
I don't remember any easy ones, tragically. Okay, so obviously we graduated in 2008. A few things have changed since then. So, what are some changes that you've seen in the profession, and where do you kind of see that the factors are there that are going to kind of shape future changes in the profession?
Yeah, so just a few. I think, there's been big changes and small changes in the profession. I think sometimes we want to see more change rather than less change. But um, just to give you an example, I think some of the bigger changes that we have experienced recently within the last 10 years, 5 years, maybe even a year for some states, have to do with dental therapy. Dental therapy, I think, has been one of the biggest changes in the profession, or that has affected the profession in one way or another. Some people might see dental therapy as a really positive thing for dental hygiene, whereas others might not think that dental therapy is actually that great for dental hygiene. In New Mexico, for example, since I am in New Mexico, let me just talk about New Mexico. In New Mexico, when we worked, then New Mexico worked on the dental therapy bill for many years. So let me just start there. But the bill actually got through the legislature and was passed in 2018. And coincidentally, in 2018, I was serving as the president of the New Mexico Dental Hygienist Association. So I did have the opportunity to work quite closely with individuals during this legislative process. And one of the things that I can mention about dental therapy in New Mexico is that it took a twist on how it was coming about. So originally it was meant to be a dental therapy model similar to some other states where um, you could be a dental assistant, a dental hygienist, and didn't matter, right? Like didn't matter what degree you had. You could then decide to become a dental therapist and go to dental therapy school. And if you were a dental assistant prior, or if you were a dental hygienist, then you would get credit or advanced standing for courses that you took in your respective institution. Um, at the time in New Mexico, as part of our work with the association, we felt very strongly that if dental therapy was or is this great movement that is supposed to advance the profession forward and improve access to care and do all of these things that it is meant to do, we felt that the hygienist model would be the best suited model to lead dental therapy. And we decided that dental therapy in New Mexico would be best if it was a dental hygiene model, meaning that you would have to be a dental hygienist to then move on, increase your education, increase your skills in going to dental therapy. Because by the time that you become a dental hygienist, you would have all of the knowledge necessary to do the preventative services, to do the hygiene, to do the education, to do community. Like dental hygienists are very well rounded in education, as you know. In all areas, prerequisite work, education, and whatnot. So that was our take. There is nobody better suited to be a dental therapist than a dental hygienist. And if this is something good for the profession, well, then we have to keep it being a dental hygiene based model. Now, not all states are like that. There are differences in how dental therapy is put together in different states, and that's totally fine. That's to be respected from the different perspectives in how things are going to work in different states. So I think that's been one of the biggest changes that we've faced most recently. Other changes that we've seen in the profession are the administration of local anesthetics, right? New Mexico, we were lucky enough to be one of the very first states that allowed the administration of local anesthetics
Mhm.
under indirect supervision first, and direct supervision. And now we even have the ability to administer local anesthetics under general supervision, which means that the dentist doesn't necessarily have to be in the building for the hygienist to administer local anesthetics. As long as the hygienist meets certain requirements and they get the endorsement and whatnot, then they can administer local anesthesia without the dentist in the office, as long as the dentist has prescribed it, right? And I think that's a huge plus. There are not very many states that allow that. I mean, we have our neighbor, Texas. I'm in Las Cruces right now, so I am 30 minutes from Texas, and that was one of the or that's still one of the main differences, because our graduates here in Las Cruces graduate with their certification in local anesthesia, and that's includes all of the blocks, and 30 minutes from here, if they drove south to El Paso, Texas, and they wanted to work in El Paso, well, they couldn't utilize their skills in local anesthesia because Texas didn't allow it. Now they just passed local anesthesia last year, I believe, and they're working on their rules, regulations, and how things are going to work. I haven't read their bill, to be honest, but I've heard rumors that it is going to be supraperiosteals or infiltrations. This is not, it does
Really?
not include blocks. But yeah, I mean, for Texas, that's
It's
a
a step.
plus, right? That's a
It's a
step
step.
forward. It took them a long time to get there, and the association, the Dental Hygiene Association in Texas, has done a fantastic job in advocating, being at the legislature for many years, and pushing forward in trying to get local anesthesia in Texas. And they finally were able to accomplish a step. I think there's a ways to go, but this is the first step, and they are in the right direction. Um, other things, collaborative practice models, independent practice, working in hospital settings, and public health. In my case, I am more of a public health education type of guy. I
You
don't
were under
necessarily.
Christine Nathy forever, yes.
Yes, yes. So I don't. That's my take, right? So that's the biggest change that I've seen. As far as the private practice hygienist, I mean, lasers have been, even though they're not like brand new, for hygiene, I think they're making their way more and more into schools, more and more into private practices. So that's a plus. I think I've heard that there's some other areas where even Botox is getting into the practices, they for dental hygienists. So yeah, there's change all the time, and I think as educators, we just need to adapt to the change, but always try to keep, in my perspective, I always want to make sure that we keep the essence of what a dental hygienist is in mind, right?
I love that, Elmer. That
Yeah.
was so beautiful. Um, you captured like everything. Like you're incredible to talk to, Elmer, because we ask you one question and you don't miss a beat. You got all of it. And um, you know, you're like, okay, one of the changes, the dental therapist coming in. When I was a new graduate, I felt threatened by a dental therapist. I thought, oh my gosh, are they coming for my job? A few years later, I have a grander perspective on things, and I'm like, no, they are helping people. They are helping the profession. They are incredibly valuable and important. But initially, I just don't think I fully understood um, why it was happening. Like it just, I didn't have the clarity of it. And later on, I feel now that I do, I'm very, very grateful that in some of these areas we do have the dental therapists. And then, when we're talking about Texas and them being very slowly progressing to being with the rest of the country on what the hygienists can do. I absolutely love your opinion on it, Elmer, where you're so appreciative for the forthcoming efforts that are being taken place. Where in my mind, I am still angry. I am like, how are you not matching the rest of the country? Like, how can you not see that if it's so, if we can all do this across the country, why are you still holding back on your providers? And so I'm just like so progressive, and I am just so aggressive on wanting our profession to grow and further and like do as much as we possibly can for our communities. I love your perspective of just being appreciative of the progressive changes that are occurring and taking them as they are. And that's like this very, very humble approach that I love, that I needed to hear, because I'm like, you're right. We should be happy that things are progressing, even if they're not at the speed or the rate that I would want to see them at.
Mhm.
And so I just thought that was such a beautiful, eloquent answer. Thanks, Elmer.
Oh, thank you. You're gonna make me blush. I used to blush all the time when I was in school.
He did constantly blush. So what is kind of the most current definition of the dental therapist, Bill? Dental hygiene therapist.
In New Mexico?
Yeah,
Or
we'll go
in
with New
general?
Mexico. I guess you can't speak for the whole country.
Yeah, so in New Mexico, as I mentioned, in New Mexico, it is a dental hygiene-based model. So, only a dental hygienist can then progress or advance their education to become a dental therapist. And that's based on that perspective that I mentioned earlier, that, dental hygienists are very well-rounded in education and skills. They have already gone through all of their dental hygiene program, which, if you look at the standards for dental therapy, some people might argue, well, they're different. But if you look at them, a whole lot of the education part of a dental therapist has to do with the prevention, has to do with being able to provide the preventative care to individuals in rural areas and underserved communities, right? And as a hygienist, you already have that. You already have that experience because you're providing preventative, you're providing, the information, the education to patients and whatnot. So, advancing, if we want to advance our profession, then advancing our dental hygiene degree to a dental therapy model then means that, yes, well, now as a dental therapist, you go to school maybe a year more or whatever the amount of time might be, and you can gain these additional skills, right? You can gain these additional skills. Every state has different things in their scope, but if it requires, okay, placing some restorations or extracting some teeth or doing having some additional prescribing privileges, then who better than a hygienist who has already gone through a lot of schooling and just advance not just in a bad way, but advance their profession, right? Similar to a nurse practitioner model, similar to some of the mid-level practitioner models out there, and that was our perspective in New Mexico. And I can tell you that a lot of people were not happy with it, but as an association at the time, we felt very strong that was what we needed. And I think one of the pieces of the question that you guys asked was, what do we need to do, right? What do we need to do to move the profession forward? And I don't, I know there's maybe 50-50, maybe different percentages on how the hygienists out there practicing hygienists and even students um, think about the associations, right? And I'm not here to make a push for an association in one way or another, right? But my perspective is that if we want to push the profession forward, if we want to see better opportunities for dental hygienists, better not only opportunities as far as jobs, but as far as being better treated in the practices or receiving better treatment where they work, um, those hygienists need to get involved. They need to get involved, whether it is in the association, they need to get involved in the legislative process, they need to get involved in advocating, with different groups. And I mean, the associations is a great way to get involved, but that's not the only place where they can get involved. Um, what I don't like to hear from a lot of people sometimes is when I just hear hygienists complain, right? When I hear them complain of how bad it is this, how bad it is that, and you ask them, well, what are you doing to make those changes? Well,
Yes.
nothing, right? I'm not doing anything. And well, then if you're not that change agent, if you're not going to be passionate about, if you say, well, it really bothers me the way in which we don't get benefits. So it really bothers me the way in which we don't have the privilege to administer local anesthesia in this one place. But then do something about it, right? And the only way to do something about it is to get involved. It's the only way for you to get your opinions, your voices heard, your ideas be marked is if you are at the table with the people making those decisions. And I think for hygienists, if you can do it because that's the only way that we are going to move our profession forward. I got your brain spinning, Amanda.
Yes, you do.
Well, yes. No, there's a lot to take in. It's just an interesting, I guess, place in time for dental hygiene. Like, it's an exciting place in time that we are making these steps in our profession, and even something along the lines of a therapist bill instead of just, I think a lot of the buzz that we heard, especially at RDH Under One Roof this year, was, well, states are allowing assistants to start to scale. And so it just feels like some of this progress that we're finally making as providers, like it almost feels like our legs are being swept out from underneath us by states allowing assistants to start to take our positions. I don't know. Does that make sense?
Yeah. I mean, it does make sense. And I mean, let me just offer maybe like a twist to that, right?
Yeah.
Not not gonna try to convince you in any way, right? But like I've been really pondering on that idea, and I've had discussions here with individuals, right? Um, and I think it's interesting, right? Because as hygienists, here we are. So we are where we are, and we have the dentists, right, who are the individuals or the profession that owns it all. To just put it in that context, right? And so hygienists have to constantly be advocating and have to be at the table, looking for ways in which they can advance their scope of practice, right? And the only way that hygienists can advance their scope of practice is by doing that, going through the legislative process. And what does that mean for dentists? Well, dentists probably feel the same way that we do, right? When somebody says, well, we're going to allow dental hygienists, dental assistants to do X. So we get upset, right? Because we feel that, well, that's not fair. They're going to be taking part of our job. Um, Dentists, in my opinion, are kind of like the same way, right? So when we ask for more scope of practice, that's impinging into what they do on a daily basis. Sometimes they feel the same way that we feel, and they're like, well, no, that's our scope of practice. Like, we don't want to allow dental hygienists to do X, Y, or C, because then we're not going to have jobs. The hygienists are going to take the jobs. And my perception to that is that if we really want to change our world and we want to change the world of the people that we serve, we need to be more open, right? We need to be more open about the scope. And let me give you that example for the assistants doing supragingival scaling, because I think that's what it is, right? Supragingival scaling.
Yeah.
So, if we are trying to serve as many people as possible, if we are trying to increase access to care, the only way that we can increase access to care is by changing the models. And again, that's my opinion. Okay, I'm not quoting somebody or anything. That's just my personal opinion.
I'm not staring at you with daggers. I promise.
So, like, if we change our perspectives and if we change our models, the way that we operate dental hygiene, the way that we operate dental assisting, the way that we operate dentistry. But that takes a lot of leadership, that takes a lot of understanding and giving, right? Because if we're saying, okay, so there's a lack of dentists or there's a lack of dental hygienists in the country, we need more, we need more people to do those jobs. Well, what are we doing with dental therapy? With dental therapy, we're basically saying, well, now we want to be able to do these additional skills, right? We want to be able to practice this additional scope that at some point, that scope was exclusive for the dentist, right? And now in dental hygiene, we're doing that, right? So now we can do a little bit more and a little bit more. And it's taken really a lot of battles to get there, right? When it shouldn't take those many battles to get there. If we were truly vested in improving access to care in our communities. Because if we're truly interested in improving access to care in our communities, I think we have a really wonderful workforce made out of dentists, hygienists, and dental assistants, right? And if those three professions could work in conjunction to address access to care issues, we wouldn't be where we are. I think that we are where we are because we are very close-minded on each profession, right? Like, we're very protective of the things that we do and the things that the other one does, and we don't want to cross those lines, right? For example, if let me put it this way: so if hygienists, we want to advance our profession, we want to do additional procedures, would it be beneficial for the hygienists to be able to do those procedures? And if the assistants can do supragingival scaling, well, who cares, right? I mean, they don't have the education to be able to do subgingival scaling because that requires additional skills, right? But we have to be realistic in a sense too. They are doing it whether we like it or not, right? And they are doing it under the table, or they are doing it legally or not legally in offices, or not. I mean, I don't know, but it's like I personally don't see that as a huge problem if hygienists could be able to leverage, doing some other procedures that currently are not part of their scope, right? So, okay, you give in a little bit, but you gain a little bit. So, you have a better trained, a better skilled workforce from dental assistants all the way to dentists. A workforce that helps one another, right? So, okay, as a hygienist, gosh, I have this full day of SRPs, right? Deep cleanings, NSPTs, whatever you want to call it. But then you have all of these patients, maybe kids that would be okay with supragingival scaling. I mean, I don't know, right? Um, like I said, it's just a point of view, right? Um, but it's very controversial, that's for sure. Very, very controversial. And um, but again, just to close it, I just think that if we want to move forward, we all in the dental profession need to be more welcoming and accepting of you know giving and taking to some extent.
It definitely makes sense. I think so the majority of my practice has been in rural settings. Even here in Utah, where I live is still considered rural. Right, Joffrey? Everybody in Salt
Yes.
Lake considers this the butt face of nowhere.
Yeah.
It's basically Valencia County to Albuquerque. But
Mm,
I think something that's always made sense to me is a hygienist being able to almost work with a doctor. Like, for instance, I worked in Socorro, and Catron County, Sierra County, all those counties, there's a lot of very rural communities in there. Could a hygienist not do almost like mobile dentistry where they do the triage, and that way it wastes less of the doctor's time? You don't have to diagnose anything. You've got your triage out there.
mhm.
Make it happen. They, patients able to go in, get it done, not spend a full day in the doctor's office, and not waste the full day of the doctor's time. Anyway, I feel like
Well-
this is a topic that we could like dive into.
We could talk about it forever.
Good.
Right.
And I am like very progressive, grassroots, let's get this movement going mindset. I'm okay with the idea of some of the assistants doing that supragingival scaling. Yeah, and this has not always been my perspective, Elmer. Not at all. Like, my mindset growth has completely transformed through my career. Like, this is not who I was 10 years ago.
Mhm.
Just last fall, I was in New Mexico presenting to students, and they were the ones who told me that assistants were scaling teeth on the reservation. And I thought, like, how dare they let this happen? And then I went home and I thought about it, and I'm like, well, somebody has to do it. There's not enough of us. And I'm a Salt Lake girl. I'm not gonna go scale teeth on the reservation. And they can't find a hygienist to do it. So I'm like, okay, work with what you got, like, if that's what it is. But then I'm also thinking, like, how much more productive could my practice be if I screened somebody and said, okay, the assistant can do this and I'm moving on to the next patient, and I'm going to go do this scaling and root planing real quick here, and then I'm going to go do this adult prophy who is known for gingivitis, and then the assistant can finish up on this next 12-year-old that's coming in. Like, we could be seeing a much higher volume of patients. We could be making more production for the company. We could be helping more people in the community if we could, like, cohesively, like, all be okay with
Mhm.
sharing some of these tasks.
Right.
And it's kind of like, when we go back to thinking about the Texas situation where the hygienist can finally now do some injections, but not all. I'm wondering, how do the Texas dentists feel about having to come numb for the hygienist all the time and take time away from their actual production? Because in my state, I feel that I'm saving the dentist time, and they can go do that root canal or go do that implant. They don't need to worry about me because I'm going to stay in my lane and I'm going to get them numb and take care of my own schedule and not take time away from them. So I do see the whole picture now, but I haven't always had that perspective, Elmer. Like, I
Mhm.
in the past was definitely kind of like, no, an assistant could never pick up a scaler. Like, that is my job. I worked way too hard to get where I am to hold these scalers, because I was feeling very territorial of it. But
Right.
now I am like, wow, we could help. I actually chose to be a hygienist to help people. We can help more people if we could work together and we could all like just be smart as a whole unit, and not, this is my skill, not your skill, or this is mine, not you. Like, uh we're almost holding the profession back when we are
Territorial.
yeah,
Yeah.
exactly.
Yeah. When the same applies on the other side of the spectrum, as I mentioned, right? Because you're talking about production. If you work for a company, even if you work for a private practice, um, this happens to a lot of hygienists, right? Like if they don't have a patient on their chair, sometimes they have to clock out. Sometimes they send them home or whatever. I've heard stories from hygienists like that.
Mhm.
But okay, so if hygienists on the other side of the spectrum, instead of sending the hygienist home, if they had an additional allowed scope of practice, then they could be utilized to do that. If they don't have an SRP, if they don't have a prophy, well, if the dentist is overbooked and they have too many patients and they can see, the next patient's trying to get an appointment, it's going to take them 3 or 5 months to get an appointment. Why couldn't the hygienist do some of those procedures, right? Maybe doing some of the small child extractions or some restorations. Even if the dentist had to cut the tooth or whatever. I mean, you get the idea, right?
Right.
So, and that goes along being territorial and being, you know, close-minded. Okay, this is my scope, and you don't have the skills to do that. But everybody can get those skills. If you go to school and you learn them, you can get those skills, right? It's like I always tell, you know, it's not a God-given power. You go to school for a reason. I mean, dentists go to school to become dentists. It's not a, like a wand that says, okay, now you're a dentist, right? So you went to school and you got the training. You became a dentist. You learned how to do diagnosis and assessment. Because that's one of the big arguments, right? Like, well, hygienists can do diagnosis because it takes X, Y, and Z. Well, why can't they do it, right? Why can't hygienists diagnose within their scope of practice? Hygienists are highly skilled and trained, and they've gone through many years of schooling to be able to determine, is this perio, is this gingivitis, is this, deep pocket, is this vertical bone loss, is this horizontal bone loss? Like, what's stopping? I mean, we know what's stopping the hygienist from diagnosing those things, but why, right? Why is it that's happening? Instead, you know, it could be much more productive if the hygienist can diagnose within their own scope of practice, and they wouldn't have to wait for the dentist to see the patient 3 or 4 months later to start treatment.
Right. I mean, we in my hygiene program, we learn how to read a radiograph very well. We know what an abscess looks like. We
Right.
know what an MO on 14 looks like. We know what these things are. And then it's like we take pharmacology. We know what pre-medication this person might need. We know we know so much, and then we have all this knowledge and we can't even implement it.
Right.
And I think that is like part of the barrier. It's like I want to be so progressive, like, let me sign the pre-medication for the person getting amoxicillin. Like it's okay. Like, what harm is that going to do? Or let me tell the patient, you need to come back for that MO on 14. I know that's a filling. Let me just call it a filling.
Yeah.
And I think that's where the territorial part comes in, is because the hygienist was trained to know so much. We are so knowledgeable. And then, like Amanda said earlier, our legs were just cut off. Like, we can't say it even though we know what it is.
Hmm.
And so then it's like we're almost bitter that we can't do things, so we don't want the assistants to do things. So it's like we were held back, so now we want to hold these other people back, and it's just this vicious cycle. I don't even know how we change that, but it's really a disservice to the community because the hygienists are brilliant and they know so much, and we can do way more than just hold our scalers all day. And I am very excited to see the hygienists in action at getting legislative changed so that we can do more things. I think the more people that get involved in making these changes, like the future is probably going to look amazing for hygienists and assistants and dentists alike. Like I think eventually we can all cohesively work together when once the patient truly becomes the primary focus and not ourselves. I think once we all have this respect for one another, then we can finally start caring for the community at the level it demands.
Absolutely. And I mean, I think I'm gonna repeat what you said earlier. I think you said it beautifully, right? When we start thinking and caring for our patients, that's when we're gonna make the biggest change, right? When we stop thinking about, okay, this is my profession and you can't touch it, right? From all three parts, right? I'm not just saying hygiene, dentist, hygienist, and assistants. We all need to work together. And if we think about patients first and addressing some of those bigger issues, I think that's a really good way to move forward.
So, speaking of moving forward, Elmer, what are your future aspirations?
My future aspirations.
Are you going to do like a postdoctorate degree next?
No. No. I didn't know what I was going to do with my life after school, right? Since I have been in school most of my life. But I think after finishing my doctorate degree, I've been able to focus on other things. I'm working on obviously on my career, I got my tenure already, but my getting to the highest level of teaching, which is being a full professor. So that requires a lot of work as well. I have served as interim dean of the health sciences program, and it's not that I didn't like doing it. It's just that I perhaps did it in a difficult time because I had the opportunity to serve as the health sciences division dean in 2020, right during the pandemic. So that was a very challenging for health sciences. So it was a lot of work. It was cumbersome. It was, I think I got work times 5 because, we had to be changing protocols and changing things like from one day to the next. And I did learn a lot, don't take me wrong, but I don't necessarily know if that would be where I want to go moving forward. I mean, I think at some point probably, but I think right now I am at a point in my life where I am happy where I am, right? I am happy educating dental hygiene and dental assisting students. I am happy, leading the programs, mentoring faculty, doing the things that I do, being a site visitor for the commission. I do enjoy that quite a bit because, that allows me to see what other programs are doing, how they are doing things, and provide feedback if feedback is needed. I don't necessarily say that I want to stay here the rest of my life, but I think right now, and maybe for the next 5 years or so, that's where I see myself. Um, Maybe in the future, and I would say maybe after 5 years or so, then I might seek doing something different.
I have a feeling that's going to happen. You're going to get like the 7-year itch or something.
Right. Yeah, who knows? We'll see. I mean,
Well,
opportunities come to your door, and sometimes, even if you don't expect that you want to make a change, the opportunity is there, and you just do it, right?
yeah.
So that's my take. If something comes up, and I feel that I'm ready for it, and it's something that I feel passionate about, then I will do it. Because to me, if I'm going to do something, and that's what I would tell my younger self or other people. If there's something that I feel passionate about, then that's what I will do. I did dental hygiene because I felt passionate about dental hygiene, because I felt passionate about access to care, about improving oral health. I didn't do dentistry, not because I couldn't get into dental school. I didn't do it because I didn't feel that that was the profession that I wanted to pursue. So I don't want to take the dentist job. I don't want to do fillings. I don't want to do root canals. I don't want to do crowns, right? I'm happy where I am. If there's maybe some other things that we can do to provide better service to patients, then that's fine. And professionally, if the opportunity gets here, I'll take it.
I love it. There's nothing wrong with contentment.
Nothing
There's
wrong.
nothing wrong with that. So, well, we usually wrap up with 2 questions that we ask every guest. So I'll start with the first question. Joffrey, you can take the second question. So, Elmer, what piece of advice do you wish you could go back and give yourself as a new graduate?
Well, geez, that's been many years. um, like I look back at when I was an undergraduate, when we went to school, and honestly, I would do it again. I know there's people that feel, oh my gosh, I will never do that again. Um, I think that happens sometimes if you are truly not passionate about what you do. But I do. I really enjoy what I do, and if I had to do it again, I would do it again. The advice that I would give myself: be careful and don't get into so much debt.
Solid. That is solid.
Yeah.
Absolutely. Elmar, that's very interesting. No one has said that yet, that they would want to redo it. And I think I'm with you on that.
Yeah,
I
don't
could
regret it.
redo my hygiene program and have a completely more positive, humble uh, energy with me in the clinic. I wouldn't be as terrified.
Mhm.
I wouldn't be as afraid. I wouldn't be second guessing myself.
Mhm.
I would go in there with this, I am learning as much as I possibly can today.
Yeah.
And whatever somebody tells me, as coming from a clinical instructor or advisor, I'm going to just absorb that like a sponge, and the student mindset I had was very afraid that I wasn't going to pass, afraid of boards. I was afraid of not doing everything right. Like I would definitely go in there and be a completely different person. I
Agreed.
would I would just believe in myself. I wouldn't be afraid. I would just So I agree with that, Elmer. I think that is an amazing answer to Amanda's question, because I'm just like soaking that in right now. Like, wow, how many things would I do differently if I were to re-enter a hygiene program?
Mhm.
And uh, I think that just fuels why I love to go visit students. I think that like I
Yeah.
love talking to the hygiene students and telling them everything I know. And Elmer, I do definitely want to talk to you later about being a site visitor, but I will do that off this
Here's
call.
the drop. Here's the drop.
I know I want to learn more about that, but we're going to end today asking you, what do you wish you would have learned in school that took you years to learn as a dental hygienist?
Wow. I mean, I think in school, instructors do the very best, right? I think instructors do the very best to give us a plethora of information of what you need to know to be a good dental hygienist, right? But what I wish I had learned in school, that I'm still learning actually, is, is to communicate well with patients. And what I mean by communicating well with patients is being able to understand their point of view, their stance on treatment, their stance on care, and respecting their points of views, right? Because I don't, and again, some people might disagree with my opinion, my perspective, but um, I have learned that if you want to obtain better outcomes on patient care or patient compliance, the best way to do it is to getting your patients involved in the process, right? And you get your patients involved in the process by understanding where they're coming from, how they were raised, where they were born, what pretty much all of their social, cultural understanding, right? Being aware of the differences and not trying to push them to comply with something. Obviously, I'm not saying that we don't have to give them the information because we, as educated and trained professionals, it is our responsibility and our job to give them the information. You have periodontal disease. These are the risks. This is where you're going if you don't, you know, take care of yourself. But I feel that there is some leeway. I feel that there is some room for collaboration between patient and provider, where if and one of the key aspects is like flossing, right? Many of our patients don't want to floss. I hate flossing myself, right? And does everybody really have to floss? You know, well, to some extent, right? But maybe you don't have to do it every single day, right? Maybe if you start somewhere, maybe if you start even once a week, right? That's going to be better than nothing. You're not going to get to 5 days a week from one day and having a 1 hour appointment with your patient to seeing that change the next time that you see them again. That's impossible. That's not going to happen. And I think that's what took me a little while to understand. And now, and I'm not doing clinical hygiene, but that's what I teach my students as well. Like, learn how to respect and understand your patient's perspectives and incorporate as much of their points of views and cultural um, likes and dislikes into the treatment, right? A dislike might be flossing. Well, what do you do? Maybe they're using water picks. Maybe they're using other techniques that may not necessarily substitute flossing, but could potentially get them to some good oral health, right?
Mm-hmm. That's real life.
That's real life.
Yeah.
I
So
know, that's beautiful. I was thinking like I am with you 100%, Elmer, but I know if I ever posted something on Instagram that was like, I only recommend my patients floss once a week, the whole hygiene community will eat me alive. But
Yeah,
that's the reality of it is you have to meet your patients on the level that they're on. And
absolutely.
sometimes that is my recommendation. If you're flossing 0 for 6 months, once a week is way better than that. Go ahead
Right.
and floss every Sunday. And um I can just hear all the negative comments rolling in on that perspective, but I will stand by that 1,000%. We
yeah.
have to meet our patients where they're at, communicate with them on their own level if we are
Mhm.
going to make any progress in
Right.
their oral health.
But even if that means that you challenge the status quo, right? I mean, yes, there is a way of doing things, school way of doing things, but sometimes you have to tweak things a little bit to make it work, and that's okay. As long as your end result gets you to getting that patient to a good state. Um, I mean, how you get there to me is the least important, as
And
long as
that
you're ethical.
yeah, exactly.
Yes,
And that's
yes.
Right.
that's what sets the real world dental hygienist clinician apart from the textbook status quo. Like there is an element of matching the patient and communicating with them that's really not I mean, we talk about it in the classroom, we do, but it's not like uh necessarily widely accepted in the community. Like if you they I feel like in the community it's more like you have to recommend the ideal quota of home care. You have to do, the top notch level of care. And that's seriously just not practical for everybody. So, Elmer, I think that's a beautiful response. I think you are just a beautiful human being. And I am so glad we got to spend this evening with you today. And I hope we get you back so we can talk about other things. What do you think, Amanda?
I think we definitely figured out some good topics to talk about with Elmer that I think are very applicable to other hygienists as well. So I think if he'll have us back, we'll have him back.
I know.
Awesome.
So,
No, thank you guys. I really appreciate it.
yes, Elmer, the
So
podcast is picking up some speed. We're getting more listeners, we're getting more followers. So, we truly would love to have you come back and talk to us again.
and we fully expect that you're going to assign all of your students this podcast as like weekend homework when it releases.
Imagine that, right? You're assigned to watch the podcast.
No, we do want to come visit your students. I told Amanda
Yeah.
if Hygiene Elevated gets into Elmer's school at New Mexico, she has to come with me. Like it's
Right? Yes.
unacceptable if she doesn't book a ticket with me and come to New Mexico and do the presentation with me.
We'll take her to
Absolutely.
some good New Mexican food. Real
Yes,
New
yes,
Mexican food.
yes. And we have to go to Peru, Amanda.
Yes. One of these days, Elmer.
Yeah.
I love it. Thank you so much for joining us today, Elmer.
Thank you guys. Appreciate it. You guys have a nice rest of your day.